Patricia, today's date's the 21st of March, and you're back, and you had considerable relief from stiffness for about 2 days after I did your tooth, didn't you?
Yes.
Okay, and you haven't lost all of the gain, but you've lost a fair amount, have you not?
Yeah, I'm getting more achy and stiff.
You're getting more achy.
But
Okay.
it's not too bad in the day, and night it gets really,
Okay.
really bad.
Well,
I can't sleep.
We're going to check your tooth again. What I want to see is you get out of that chair and walk to the door, please. Okay. All right, and get your arms over your head. And down. And up again. How is your freedom in doing that compared to a couple days ago?
It's better.
It's still better.
Yeah, it's
Okay.
better.
Because that's better than when I first saw you.
Mm-hmm.
So that hasn't gone away completely yet either. All right, but when you walked to the door, did you feel achy and stiff?
Yeah.
Okay. Now we also know that you have lead poisoning,
Right.
right? And you're being treated for that, so that's a factor as well. So let's go ahead and do your tooth again. Okay, now this is going to be on YouTube, and I have your permission to discuss some
Yes.
other private matters, correct?
Yes.
Okay. I want the viewer to know that you also have scars under both breasts, and we don't need to get into the reason why, but they tested positive when you came in, and we treated them. All we did was we injected them with some Procaine, and they're checking negative. Now, those scars under your breasts cut across the stomach meridian. And that deals with, in Oriental medicine, in flesh tissue. So that could be part of your problem too. Now, that treatment has held. So they didn't test positive today, but your tooth still tested positive. I just treated your tooth again. I'd like to see you get out of the chair, walk to the door, and then sit down and tell me how you feel.
I feel loose. It's loose. It's just loose. It's very different.
It's very different.
It's very different.
Just that quick.
Just that quick. It's loose.
Your whole body.
Yeah, I've been
told
like
me-
a 90, or I could barely move.
Yeah, when you walked in the door today, you said that you have been feeling like a 90-year-old person, and now
Like I have a very bad flu.
and comparatively, after I do your tooth, then you feel like a teenager.
That's true.
Is that what you said?
That's exactly true.
Okay, so we've done your tooth a second time, and from my perspective, when I get a result like that twice in a row, the odds of the tooth being directly involved, are well over 95%. There are no 100%.
Mm-hmm.
So that needs to be looked at. I'm really suspicious, and I recall that when I found that tooth to begin with, it was after I found it that you told me that even the dentist was concerned about it.
Right. It
Right?
needs to be worked on. I don't
It
know
needs
what.
to be worked on.
Yeah.
Well, I'll be honest with you. From my perspective, a root canal, a dead tooth, is an infected tooth, and it's pumping toxins into your body. I don't tell everybody with a root canal to get it taken out. That's tough. But
I have a lot of root canals.
I know you do. But if I find it, and there's a disturbance, and you see this kind of effect, yeah, then you really have to consider it. Is that making sense?
It does make sense. But the implants are safe.
They're probably safer than root canals because root canals are dead teeth or biological structures that are rotting.
Mm-hmm.
And the implant is not a biological tissue, it's rather inert. It's not completely inert, that's the issue. There's nothing that's completely inert, so then what's your body doing to that metal?
Well, what scares me is, they're $5,000 a piece, and you go through agony to get them. It takes over a year to finally have a new tooth. And then when I came to Santa Barbara and they looked at them, they said, you're losing bone. So I'm afraid they won't, they won't hold up.
If you lose bone, the implants won't hold up. That's true. You need bone. But the implant and the bone work together. If you don't have the implant, you are going to lose bone.
Okay, but maybe there are things you can do to help me to make the bones stronger.
There might be.
Mm-hmm.
Well, there's osteoporosis that really needs to be addressed, the issue of osteoporosis. And I just learned some things about the mineral boron, which are exciting. I'll deal with that with you. But the purposes of this, what we're doing here with this video that goes on YouTube, is to let the viewer know, hey, teeth are a real problem, and those scars on your body, we don't need to show them the scars under your breast.
Mm-hmm.
But those scars can be a problem. The nice thing about surgical scars, though, is that one treatment, sometimes more than one, but not a lot, one treatment often resolves the problem. And I think it's resolved the problem in you. That's why there is overall improvement in you.
Mm-hmm.
But that tooth is still a problem, and what I did is very temporary.
Right.
If
You just took it out of the
circuit
Yeah.
for a limited period of time. Okay, thank you. Now we're also doing ozone on you, and you're feeling better from that too, is that correct?
Yes. I have much more energy during the day.
Okay, thanks.